New question. Member from Kitchener-Waterloo.
Well, thank you very much, Mr. Speaker. And my question is also for the Premier. Premier, is there currently a surplus of hospital beds and nursing positions in our province?
Premier.
Speaker, I'll give this to the Minister of Health.
Minister.
Speaker, thank you very much. I'm quite pleased with the level of investment. We've seen an over $11 billion investment, a 37% increase in the province of Ontario, over $1 billion to reduce wait times, funding for over 8,000 new nurses. And I would compare and contrast that, Speaker, with the member opposite during their time in government, where we saw a reduction in the number of nurses by over 6,000 under their watch. We've seen innovative new programs like family health teams, 150 to see over 1.8 million additional Ontario patients. We're expanding family medical school residency spaces by 87% and medical school spaces by 23%. Speaker, we have over 100 major hospital capital projects which are currently underway through Renew Ontario, our government's capital infrastructure.
Supplementary.
Mr. Speaker, through you to the Premier. Premier, your minister's answers continue to insult the intelligence of people in the province of Ontario who are seeing a decreasing access in care when it comes to health. First of all, let me remind the Premier that we added 12,000 nursing positions, and I would also say to you, currently, we are seeing hundreds of nursing positions cut by this government, outpatient services and beds. Hospitals are desperately trying to balance their budgets at a time that they have fixed costs of about 5% as a result of heat, hydro, and salary increases. You said you would protect public services. I ask you today, how many more nurses and patient services and beds are going to be cut and eliminated?
Minister.
Thank you very much. I think I've highlighted the difference in contrast between the approach of the member and between this government. In fact, it is the avowed position of the member opposite and her party to eliminate the Ontario Health Premium. That funds health care for $3 billion annually in the province of Ontario. I think the member quite rightly points out that there would be bed reductions and layoffs to the extent that we've seen previously if they were allowed to form the government and to be able to cut vital services to the tune of $3 billion in the province of Ontario. And Ontarians a year ago rightly said no to that approach. They said that they wanted to see a collaboration, the introduction of family health teams, the introduction of nurse practitioner-led clinics. They wanted to see some of the investments as we have previously, Speaker, where we have over 7,000 more frontline staff for long-term care homes and restored staff. We have over 227,000 more Ontarians receive.
Thank you, Minister. Final supplementary.
Thank you, Rodney.
Mr. Speaker, those responses continue to insult people in the province of Ontario who continually are waiting in emergency rooms for hours. We have long-term care patients wallowing in beds in hospitals. When is this minister finally going to realize he has a responsibility and an accountability to people who are increasingly, day by day, seeing hospital health care cuts? I'm going to put the Premier on notice. Starting today, we will track every nurse you fire and every bed you cut. You've already fired 791 nurses. Taxpayers deserve to know about your haphazard actions. So I ask you today, Premier, where is your plan to prevent the erosion of our health system and access to health care?
In fact, Speaker, the member is quite incorrect. She equivocates to this House. Wait times in this province are down. And that's because of sustained and persistent effort. And I'll share with the member, in fact, the information is publicly available on a website We have angiography down 53%. Angioplasty down 50%, cataract surgery down 63%, hip replacement down 52%, knee replacement, Speaker, down 51%, CT scan wait times down 46%. Cancer surgeries down 19%, MRI scans down 18%, pediatric surgery, Speaker, down 21%, general surgeries, in fact, are down 4%, and Speaker, that's why I've had the great privilege to unveil a pediatric strategy and further general surgical wait time strategy in order to drive wait times down even further. Speaker, the real danger would be if that member were...
New question, the member from Hamilton Centre.